Welcome to Nutri Normal, your go-to destination for all things health, wellness, and vibrant living. In today's video, we are going to let you know about 10 common habits that can harm your kidneys. Let's get into the video. We all try to live as healthy a life as possible. There can be many factors that affect our health, including our socioeconomic status, access to care, access to nutritious foods or grocery stores, and our inherited health risks. When we think of being healthy, we often think about weight or the pain we experience. But how often do you think about your kidneys? Most of us have 2 kidneys, located deep in the abdomen along either side of the spine. The main job of the kidneys is to cleanse the blood of toxins and transform the waste into urine. When the kidneys aren't functioning properly, those harmful toxins and excess fluids can build up in the body and may lead to kidney failure. Symptoms of kidney failure can include high blood pressure, extreme fatigue, persistent headaches, swelling in the face and ankles, as well as lower back pain. What you may not know is that there are some common habits that can actually harm your kidneys. Let's know about these habits in detail. Number 1. Overusing painkillers. Overusing painkillers, especially non-steroidal anti-inflammatory drugs like ibuprofen, can harm the kidneys. These drugs reduce blood flow to the kidneys. They do this by blocking prostaglandins, which help keep blood vessels open. Reduced blood flow strains the kidneys. Over time, this can lead to chronic kidney damage. This condition is known as analgesic nephropathy. It weakens kidney function and may cause kidney failure. In some cases, overuse can cause acute kidney injury, AKI. AKI happens when the kidneys suddenly lose their ability to filter waste. The risk is higher in older adults and those with existing kidney issues. Dehydration also increases the danger. It's important to use painkillers as directed. Always consult a healthcare provider for long-term pain management. Number 2. Not drinking enough water. Water is essential for kidney function. It helps the kidneys filter waste and toxins from the blood. When you don't drink enough, the kidneys struggle to work properly. This can lead to a buildup of waste in the body. Dehydration also reduces urine output, causing concentrated urine. Concentrated urine can form kidney stones, which are painful and harmful. Chronic dehydration may cause long-term kidney damage. It increases the risk of kidney infections and kidney disease. The kidneys rely on adequate water to maintain blood pressure and overall health. Without enough water, they can't perform their vital functions. To protect your kidneys, it's crucial to drink enough water daily. Proper hydration supports kidney health and prevents complications. Number 3. High salt intake. High salt intake can be harmful to the kidneys. Salt causes the body to retain water. This increases blood volume and puts extra pressure on the kidneys. Over time, the kidneys become strained from filtering excess salt. This strain can lead to high blood pressure, a major risk factor for kidney disease. High blood pressure damages the tiny blood vessels in the kidneys. Damaged vessels reduce the kidney's ability to filter waste. Chronic high salt consumption can also lead to kidney stones. These are painful and can block the urinary tract. Over time, this can cause long-term kidney damage or failure. To protect your kidneys, it's important to limit salt intake. A balanced diet with low salt supports healthy kidney function and prevents complications. Number 4. Overeating animal protein. Overeating animal protein can harm the kidneys. Animal protein, especially from red meat, increases the workload on the kidneys. It forces them to filter more waste products like urea. High protein intake also raises acid levels in the body. This can strain the kidneys and lead to reduced kidney function over time. Excessive animal protein can cause kidney stones. These stones form when the kidneys struggle to process the high levels of calcium and uric acid. Over time, this strain may contribute to chronic kidney disease, CKD. The risk is higher for people with pre-existing kidney conditions. The kidneys are vital for filtering waste and maintaining balance in the body. To protect them, it's important to eat a balanced diet. Protein is needed for growth, upkeep, and repair of all parts of the body. So be sure to eat a balanced diet with fruits and veggies. Number 5. Not getting enough sleep. Getting a good night's sleep is important to your overall health, but especially your kidney health. Kidney function is regulated by the sleep-wake cycle. helping to coordinate the kidney's workload over 24 hours. Make sure you are getting the right amount of sleep and practice good sleep hygiene, including limiting screen time before bed. Number 6. High sugar intake. High sugar intake can damage the kidneys. Excess sugar raises blood glucose levels. Over time, this can lead to diabetes, a major cause of kidney damage. High blood sugar strains the kidneys by forcing them to work harder to filter blood. This extra strain can damage the kidney's tiny blood vessels. Damaged vessels reduce the kidney's ability to filter waste. High sugar also contributes to obesity, which increases the risk of kidney disease. Additionally, sugary drinks often lead to dehydration, further harming the kidneys. Consistently high sugar intake can lead to kidney complications, including kidney failure. To protect your kidneys, it's important to limit sugar intake. A balanced diet and regular exercise can help maintain healthy kidney function and overall health. Number 7. Smoking. Smoking is harmful to the kidneys. It damages blood vessels, reducing blood flow to the kidneys. This decreased blood flow impairs kidney function. Smoking also increases blood pressure, a major risk factor for kidney disease. High blood pressure strains the kidneys and accelerates damage. Additionally, smoking can worsen existing kidney conditions. It also increases the risk of developing kidney cancer. The harmful chemicals in cigarettes cause inflammation and scarring in kidney tissues. Over time, this can lead to chronic kidney disease and even kidney failure. Smokers are more likely to require dialysis or a kidney transplant. Quitting smoking can help protect your kidneys and improve overall health. It's essential to stop smoking to reduce the risk of severe kidney damage and other related health issues. Number 8. Drinking alcohol in excess. Drinking alcohol in excess can severely damage the kidneys. Alcohol is a diuretic, causing the body to lose fluids. This can lead to dehydration, which strains the kidneys. Excessive alcohol consumption also raises blood pressure, a major risk factor for kidney disease. High blood pressure damages the blood vessels in the kidneys, reducing their ability to filter waste. Over time, this can lead to chronic kidney disease. Alcohol also increases the risk of kidney stones by dehydrating the body. In severe cases, long-term alcohol abuse can cause kidney failure, where the kidneys lose their ability to function. The kidneys also have to work harder to filter the alcohol and its toxins from the blood. To protect your kidneys, it's important to drink alcohol in moderation. Number 9. Overweight. Being overweight can damage the kidneys in several ways. Excess weight increases blood pressure, which puts strain on the kidneys. High blood pressure is a leading cause of kidney damage. It forces the kidneys to work harder, leading to wear and tear. Being overweight also raises the risk of type 2 diabetes. Diabetes can damage the tiny blood vessels in the kidneys. This damage reduces their ability to filter waste from the blood. Fat accumulation around the kidneys can cause inflammation. This inflammation further harms kidney function. Over time, these factors can lead to chronic kidney disease. The kidneys may eventually fail if not managed properly. Losing weight through a healthy diet and regular exercise can reduce these risks. Maintaining a healthy weight is crucial for kidney health. Number 10. Sedentary lifestyle. A sedentary lifestyle can harm the kidneys. Lack of physical activity leads to weight gain and obesity. Obesity increases the risk of high blood pressure and diabetes. Both conditions are major causes of kidney damage. High blood pressure strains the kidneys, reducing their ability to filter blood. Diabetes can cause high blood sugar, damaging kidney blood vessels over time. A sedentary lifestyle also slows circulation, leading to poor kidney function. Without regular exercise, the body's metabolism slows down. This can lead to the buildup of waste and toxins, straining the kidneys. Physical inactivity also increases the risk of kidney stones. Regular exercise helps maintain a healthy weight, controls blood pressure, and improves circulation. To protect your kidneys, it's important to stay active and avoid a sedentary lifestyle. Improving kidney health is essential for overall well-being. Start by staying hydrated. Drinking plenty of water helps the kidneys filter waste efficiently. Maintain a balanced diet rich in fruits, vegetables, and whole grains. Limit salt and processed foods, which can strain the kidneys. Regular exercise supports healthy blood pressure, reducing stress on the kidneys. Avoid smoking and excessive alcohol, as they can damage kidney function. Keep blood sugar levels in check, especially if you have diabetes. Managing blood pressure is also crucial, as high blood pressure can harm the kidneys. Regular checkups can help monitor kidney health. If you use painkillers, do so sparingly and only as directed. Lastly, avoid unnecessary medications or supplements that can overload the kidneys. Simple lifestyle changes can greatly enhance kidney function. Thank you for watching. Please subscribe to this channel to get more health-related videos.